Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Hello, everybody. My name is Adrienne Asta. I am serving the industry as the Massage Therapy Foundation's president. And it is such a joy and a pleasure to have on Carole Osborne and Michele Kolakowski to our podcast this week. Michele and Carole, I have a story that I want to set the stage about how we initially met. So I finished my licensure portion of my massage program in January of 2002. And I knew that I had the opportunity to learn prenatal massage from Carole Osborne, who literally wrote the book on pre and perinatal massage. So I didn't want to skip this opportunity. I had thought at the time that my practice was going to go in the direction of pre and perinatal massage. And while it hadn't manifested into a full practice, I really enjoy working with my pre-perinatal clients because of the education experience I had in the classroom that early on in my career. So I met both Carole and Michele during that training, and it was probably the most impactful and a very turn point in my career as far as how one person or two people can really have a major impact on an industry like the two of you had. It's an absolute pleasure for me to host you on our show. And I would like to turn it over to the two of you. Tell us a little bit about your background, and then we'll start talking about some of the articles that we're going to dive into today. Okay.
Adrienne, thanks so much for having Carole and I join you on the Research Perch podcast. We're both so thrilled to be here. Just a little bit about me. I am a licensed massage therapist in beautiful Colorado, and I'm a certified birth and postpartum doula with DONA International. And I'm also a certified lactation consultant and passionate about breastfeeding and feeding babies. I have been serving childbearing people and their babies for about 30 years, both in my private practice as well as in a hospital-based setting. I met Carole in 1996 in her workshop, and it also was life-changing, changed my career in a fantastic direction. And I consider Carole my professional mom. We had the privilege to work together on the second edition of her book, Pre and Perinatal Massage Therapy. And then with David Lobenstein, we co-authored the third edition of Pre and Perinatal Massage Therapy that was published last year. So I'm super passionate about the topic that we're going to talk about today. And thanks for having us. It's great to be here.
Well, I too am delighted and honored to be able to share some very, very important information with the listeners of this podcast, and to be on this with Michele and with you, Adrienne. And I must say, without diverging too much from my bio, that it is the ultimate honor to a teacher to have students go not only to one's level, but beyond it. So it's really quite a delight to be at 20 some odd years later for you folks and see where you are in this profession. So thank you for that honor. Yes, I am Michele's co-author, and along with David Lobenstein. And I have been in practice as a somatic integrative therapist for almost 50 years now. And many of those years, I have been also teaching here in San Diego, where I'm still located, and around the United States, which is where I met the two of you, and also in Canada and Scotland. And this data today is just such important information that beyond us as massage therapists. It's beyond what we can do for the individual people postpartum. It's really impactful into their families and into their communities. So it's quite a delight to be able to share with listeners what this data gives us to support the work that we have seen in our practices for so many years, and that I have seen most recently with my own daughter, who gave birth in April, and saw on a very personal level some of these very same benefits imparted to her in her postpartum time. So thank you for having us.
The pleasure is ours, for sure. So Michele, you had a really nice summary of this first article that we're going to explore. So tell us the title of it. Tell us why this particular article just struck the chord with you, and lay the foundation of the importance here.
Yeah. Carole and I looked at a number of studies that we could discuss, and we chose these two: the effects of connective tissue massage on pain in primiparous women after cesarean birth. And there was another arm of the study where one of the control groups, they did had a 20-minute opportunity for the women to share their birth stories. And so the second study is women construct their birth narratives and process unplanned cesarean births through storytelling. And, when we looked at these two studies, what we came up with is that there's such a neglect and a misunderstanding, I think, in our profession of the very early postpartum period, also known as the perinatal period. There's such a great need for massage therapy to be included as a therapeutic intervention during this time. And that's what these two studies show. As instructors of pre and perinatal massage therapy, we're often asked, well, how soon would you do postnatal massage? And the answer is day one, right? And that's what this study looks at. It's a long tradition in many cultures around the world. Massage is given every day postpartum. And then the unique challenge is, how do we bring that into the hospital setting? So Carole and I are particularly passionate about increasing our profession's evidence-based knowledge and the confidence that we have in the skills to provide massage therapy in the labor and delivery hospital setting. What I was so happy when we were writing the third edition of the book, I came across this lovely quantitative study by Colleen Simonelli and her colleagues at the Boston College Connell School of Nursing. It resonated with what I'd seen when I was working in the hospital setting for 12 years. It was remarkable to see the change in women's pain levels, their relaxation, their stress level, and their postoperative pain medication use. So when I came across this study, I was like, there it is. It shows what I saw in practice. So the objective of this study was to evaluate the efficacy of what the researchers called connective tissue massage. And Carole and I have kind of talked about that, like what exactly did the researchers mean? And one thing that came to mind is that, Florence Nightingale, who was a nurse, gave massage and the bedside for her patients. And I think perhaps they called it connective tissue massage to also highlight that the people in the study that were providing the massage were both nurses and massage therapists. So that's our guess. Unfortunately, we weren't able to speak directly with Colleen and her team to get that particular question answered, but that's our educated guess as to why. So the objective of this 2018 study was to evaluate the efficacy of what researchers called connective tissue massage to reduce postoperative pain in first-time, or what we called prima-paris mothers, on day 1 after an unplanned cesarean. And this was for babies born at full term and just one baby, not multiples and not twins. And the study was done in a large teaching hospital in the Northeast US. There were 165 participants that were divided into 3 groups. The first group received a 20-minute massage to the scalp, neck, and back. The second group received routine hospital care. The third group received what was called a individualized attention, which was the opportunity to share their birth story. And that was, as I mentioned, published in that second qualitative study about women constructing their birth narratives. So on day 1 in the study, the participants completed a questionnaire before their intervention about their pain level overall, their stress levels, and relaxation. And then after the intervention, 60 minutes later, they were asked to complete the questionnaire again. The results showed that just a brief 20-minute massage to the head, the neck, and the back, the group had increased relaxation, decreased pain, stress, and they also decreased their use of opioids on day 1 and 2 of their hospital stay compared to the other 2 groups. Additionally, the opioid use in group 1 decreased in a really linear fashion, whereas the other 2 groups, the opioid use trended down, but it was kind of inconsistent and nonlinear over time. The researchers concluded that using massage therapy during postoperative hospitalization improved relaxation, decreased pain and stress, and opioid use. And keep in mind that this is a really potent short intervention, just using a very simple massage therapy protocol that's really accessible to all therapists. And one thing that's particularly important to me is that we recognize the importance of this, what I call the 4th trimester, where it's like the golden hour. It's like mom and baby are still close together, just like during pregnancy, and they're getting to know one another. It's a time of pretty intense bonding. It's also when feeding and breastfeeding is established. So it's a very important time. And we want massage therapists to feel empowered to be able to reach this population. Carole, do you want to talk about the massage therapy protocol itself?
Yeah. One of the things that we thought that would be helpful for listeners would be to hear more about what the actual techniques were. And we are so grateful to the researchers and their assistants who did answer quite nicely for us some of our questions. And of course, we're the kind of people who, we continue to have more and more questions. The more answers we get more questions. So we weren't able to get our second level of questions answered. But this part of it was what was really great to get answered, which is, what did you actually do with your hands? What kind of touch was so potent here in 20 minutes time, right? Mm-hmm. So especially since in reading it, we couldn't get to, as Michele said, we couldn't get to the use of connective tissue massage, that terminology, because both of us have been trained in, and in fact, we teach a technique or two that come from a form of connective tissue massage, Bindegewebs massage, the German modality, but we didn't think that this was what that was. And sure enough, it wasn't. What it was that they gave us as their techniques in the outline was basically a nice, solid Swedish massage routine is what they had.
Mhm.
They had some lovely sequences of effleurage on the back, some wonderful cross body stretching. It sounded like kind of stretching. There was petrissage being done along the spine to the trapezius. On the sacrum, we were really excited about that because while we couldn't quite figure out how they were doing petrissage on the sacrum, we also have this technique that we do directly on the sacrum that has a lot of nursing research behind it, slow stroke back massage, right? That is really calming for the autonomic nervous system. There were a couple of things that the description sounded like some cross fiber friction for the paravertebrals and perhaps a couple of other places. The work went a little bit beyond the back into what they called the hips, some circles around the hips. We weren't clear about hip joint or the common term for the hip, meaning the lateral pelvis. But, you know, it covered a lot of really important territory with techniques that could really indeed do some deep relaxation. And we were, of course, you know, excited about, well, if this is what happens with 20 minutes with a good solid Swedish, now give us 45 minutes or an hour and let us add in some deep tissue work and some rhythmic movement to calm the autonomic nervous system even more, to specifically go in and address some of those pain areas, particularly the joints of the lumbar spine, the sacroiliac joint, which is so problematic, the lumbosacral junction, the symphysis pubis, the hip joints themselves. Give us a little time for all of that and to dig around and find and identify the trigger points that are left over from the pregnancy and the labor that are referring pain. And wow, what kind of results would you see then, right? But even so, it was like, you know what? This is so empowering. If you have a good foundational education, you could do something similar to this, even if you don't have the routine that they have, right? You can do something similar to this. And that means that whether you have access to a postpartum client immediately in those first 1 or 2 days, but sometime soon after, you as a massage therapist have a great potential to do some really significant impact, because less pain means less opioids, which means a more present mom, and less stress and anxiety means a more present mom who's really able to attend to her baby and their relationship, but as importantly, to attend to herself so that she isn't suffering unnecessarily, right? So it's a really exciting routine. Does any of that stimulate your questions, Adrienne, as a
For sure, yeah. So the first question that always pops into my mind so soon after such a major event, right? That's a major body event, is what do I need to be careful about? Right. So we are, in this particular paper, they talk about, almost immediate. It feels like almost immediate. They're encouraging as soon as humanly possible, as soon as logistically possible, to be able to apply the intervention. So what do I need to be careful of?
Yeah. Yeah. So obviously, to get beyond a basic Swedish massage, you need some more extensive training, right? And that most people aren't able to get in their basic education. So, but the part of the body that they study, that they applied this to in this study, that part of the body has only a few little precautions. Michele, you want to talk a little bit about that?
Yeah, I mean, generally the scalp and the neck and the back, there are no precautions with postnatal massage, except in that early time where the client may have a prior epidural site that she for during labor. So what the therapist would see is maybe a small needle or venipuncture site where a local anesthetic was used to numb the area before the epidural was administered. The epidural is usually administered in between the lumbar spine, but potentially as high as T12. And then for women that have a cesarean birth, the medication needs to be changed to give them greater pain relief for the surgery. So they will have what's called spinal anesthesia, where the medication actually bathes the spinal cord. And that is also administered through the same site if they'd had an epidural, or if for the first time they're having pain medication, then the therapist would see that injection site in the lumbar spine. She will also have a venipuncture site and some IV on her arm or on her hand as well. And so we don't do any direct massage over those areas, but adjacent to them, definitely. So those are the precautions.
Fantastic.
For that part of the body.
That part of the body. Mm-hmm.
For that part of the body, yes. Yeah.
So you'll often see in the early day that the client has that catheter that administers the medication is taped up her back and over her shoulder. So I remember in the days in the hospital, many of the patients even didn't have the tape on there because there was no more medication being administered in that same way. But the adhesive tape was still stuck to their back. So I would often take a warm washcloth and just do some gentle removing of the adhesive tape before I began my effleurage and my other techniques, like in the protocol, and then more advanced techniques to work with the stress, the musculoskeletal stress on the posterior side of the body.
Do you see any room for moving these protocols beyond scalp, neck, back? Is it necessary to do it?
Well, certainly if one of your main focuses is reducing pain and the accompanying reducing of the use of opioids, then there are definitely more advanced techniques that are aimed towards the specific common areas that that clients have because of the pregnancy itself or as a result of what they experienced during that labor. So remember, this study was with people who had labored and then had an unplanned cesarean, which means, of course, that could have been anywhere from 3 hours to 3 days of labor, or we don't know what in between there, right? Of labor, in addition to then the rigors of the surgical procedures, not to mention the emotional aspects around an unplanned cesarean. So one of the parts of this study that was so powerful for us was the fact that these folks had included in as one of their control groups, this group who got to tell their birth story. They had the focused attention of someone listening to them. And that particular study, the study constructing their birth narratives, that particular study, that group also had a reduction in stress and pain and some opioid reduction as well, though, as Michele said, it wasn't so linear and so dramatic a difference. And that too is such an empowering thing, right, for us as massage therapists, because one of the things that we hopefully have honed is our ability to listen. We listen to tissues, and we listen to words, and we listen to what has heart and meaning for the people that we are with, right? And so even then, if you didn't add some additional technique, if you did only do a well-balanced Swedish massage on the back like this study did, even if you then added in some opportunity for people to make some sense of for themselves, right? Their experience, particularly since this was people who didn't plan a cesarean, right? And some of the themes that came up in that, so that was a qualitative study where the researchers took the stories that these people told and then identified various themes in those stories. And that helped them to make some sense of it, right? And we can do that, In fact, who of us doesn't have clients who tell us sometimes, yikes, like they tell us all sorts of things, right? And it's so powerful for a person who has just given birth to be able to tell their story, particularly to tell their story if they feel safe enough that they don't have to monitor what they're saying, that they don't have to protect the feelings of a partner or a family member or a doula that they love and care about, but who did something that didn't particularly set well with them or whatever, right? So there's so much that we can offer our clients by that presence, by that listening. And the thing to note in this study is that those researchers who were giving that 20 minutes of attention weren't telling their stories. Right?
They were active listening.
Active listening. They were listening. They weren't telling their birth story or the story of the last person who had a unplanned cesarean, right?
Right.
Yeah. And I would love to chime in here as a birth doula that one of the things that's important in our scope of practice that certainly is within massage therapy scope of practice is the active listening and helping integrate the birth experience. That's something that's really important in birth doula work. Penny Simpkin, who wrote the foreword for our third edition, who's like the mother of all doulas and one of the founders of DONA International, she's actually studied this pretty extensively and its relationship to trauma in the postpartum period. And it's very important in the early postpartum time for women to have the time and space to make sense of the birth, reconstructing what happened, going into sometimes quite vivid detail of what her experience in her own words, remembering that her perception is her reality. And, some women that have cesarean births are very grateful for the life-saving procedure. And some of them also experience a lot of difficulty with the adjustment. There can be challenges with her longer recovery There can also be challenges with caring for her newborn because she just had major abdominal surgery and she's in pain. And typically there's more stress and psychological stress as a result of that. But we know from the doula studies that the very early intervention with an unhurried, open-minded, open-hearted processing of her birth experience can enhance her positive aspects of what happened and her role in it. And it can prevent trauma. I've sat in circle with women who were elders, who were in their late 50s, 60s, 70s, and older, who had never told their birth stories. And it was remarkable to sit with them and hear them tell their story uninterrupted. And you could see some of the trauma resolving. So it's important to recognize that even in a 20-minute intervention, imagine if you did the massage and processing the birth together. If you did both, how juicy that could be. And this is really important for women's self-esteem and their mental health going forward. And that's been studied. So I love that, the simple things that we know, basic Swedish massage, basic active listening, how profoundly it can show up on a day one intervention for a mom who's had an unplanned cesarean. It's pretty profound.
Stay tuned for part 2 of MTF's Perinatal Massage Research Perch with Michele Kolakowski and Carole Osborne. If you enjoyed this podcast, please consider donating to the Massage Therapy Foundation so that we can continue to bring you this and many other resources to increase your knowledge and improve your practice. Thank you.